Hello, everybody, and welcome for today's FB live session. Today, our topic of discussion is egg quality and how to go about improving it. I'm Dr. Rashmi Niphadkar, consultant at Pune Oasis Center. So, let's talk a little bit about egg. So, when a female is born, she is born with around 1 to 2 million eggs in her ovary. Since that time, the eggs are continuously dying, or what we like to call as atresia of the eggs. And throughout the reproductive lifespan, a woman will ovulate around 300 to 400 eggs, anywhere in an average range. Right, so the usability of these eggs are only about 300 to 400. So it is very, very important that we talk about egg health today. Now, primarily, there are around two tests that are going to give us an idea about the egg quality. There are two things about the egg. One is your egg count, and another is egg quality. Now, there's no test which is going to guarantee provide a result about the egg quality, but about the egg count, we can definitely go about doing these two tests. One is serum FSH, or your follicle stimulating hormone, and second is the anti-Mullerian hormone or serum AMH levels. Now, both these tests will give you a generic idea around how your egg reserve is, or how your ovarian reserve is, right? Now, once this egg reserve starts dipping, we can be fairly sure that even the quality of your eggs is going to reduce, right? So these tests will give you a generic idea about how is the count of eggs in your ovary, and then by default, what is the quality of those eggs that we can find. So two tests to remember: the serum follicle stimulating hormone and the serum anti-Mullerian hormone, or the serum AMH. So when you go to your fertility specialist, if you are somebody who wants to know about your egg count or egg quality, primarily these are the two tests that your doctor is going to recommend, and your doctor will have a fairly enough idea on how your ovarian reserve is. So remember, at the start of the Facebook live, I said about understanding your egg cycle. So if you're born with around 1 to 2 million eggs and they are continuously dying, by the time in your reproductive lifespan, you are ovulating around 400 to 500 eggs. So out of all the eggs, right at the start of your menstrual cycle, some few eggs are getting recruited. And by the time around 13 to 14 day arrives, one egg has achieved dominance, and this is the egg that is going to rupture. If you do have intercourse during those days, then this egg is going to be fertilized. This egg is going to form into an embryo and eventually come down into a uterus implant, and then you're going to have a successful pregnancy. So everything starts with these eggs. So that is why the egg quality that you're having is really, really important. Now, conception depends upon two things. One, what is the egg quality, how the eggs are growing, and if they are growing, are they ovulating? That means, are they rupturing or not? So, the entire conception is depending on your egg quality. The quality of the embryo that you're forming depends on two things. One, 50% how is your egg quality, and the other 50% how is your sperm quality as well. So 50% part depends on the women's egg and 50% on the sperm, and these both things come together, they fertilize the egg, and then the embryo is formed. Now, whether this embryo implants in your uterus or not depends on how the quality of the embryo that is being formed. What is the grading? How good is it? Is it genetically good? Is it morphologically good? And then the rest bit, it depends upon how your endometrial lining is growing. So does it have the adequate thickness? Does it have the adequate blood flow? So even your endometrium is really important when it comes to conception. But at the root of it, primarily, if the egg quality is good and the sperm quality is good, then we are going to be fairly sure that the embryo quality is good, and this embryo is going to have more chances of implantation. So that is why today we are discussing about egg quality. So let's go through a little bit on how you can help yourself have good egg quality. And the primary thing that the what forms the foundation of your egg quality is the kind of nutrition that you're putting in. So on the note of nutrition, you have to have plenty of fresh fruits, fresh vegetables. If you're somebody who is having non-veg, then fish is a good source of proteins and antioxidants. Fish oil capsules for those who are vegetarians can help a lot in boosting your egg quality. Relying on the use of complex carbohydrates instead of simple carbohydrates, For example, oats, millets are a really good source of complex carbohydrates. So relying on these foods will help you a lot when it comes to egg quality. Also, relying on organic foods and avoiding junk food, avoiding food additives, food preservatives, something that expands the shelf life of the foods can be deteriorating your egg quality. Avoiding food dyes, food coloring agents, avoiding MSG, overall avoiding junk foods. So little by little, day by day, if you keep focusing on your nutrition, that is going to help improve your egg quality. So food forms a very very important portion of your egg quality and how your eggs are going to respond. The earlier you start with focusing on good nutrition and good food, the better you're going to see on the overall picture. But even though you're somebody who has not focused on food up till now, you can start today and rest assured that your egg quality will get boosted by the amount and the quantity and the kind of nutritious food that you're getting. Second most important factor is if you're somebody who's smoking, then that has to stop. Smoking goes a long way in deteriorating your egg quality. It also increases the rate of egg loss in your ovaries and damages the DNA of the eggs that are being formed. So we see, if we consider a smoker versus a non-smoker, smokers will have more egg damage. The rate of loss of the eggs dying is also very very highly there in the case of smokers. So that is one very important factor. When you're trying to boost your egg health, you have to stop your smoking as much as possible, and that is going to really help improve your conception. Third important thing is to focus on your BMI. Your BMI should be in a normal range of BMI. If you're somebody who is severely underweight, or if you're somebody who is severely overweight, we see that your egg quality has been compromised in these cases. So try and proactively work on your BMI, get a good exercise schedule, get a good diet and nutrition angle into your life, and we'll see that your egg quality is going to get boosted. Fourth, very, very important thing in today's day and age is the kind of stress that we take upon ourselves, whether it be stress of family members, stress of home, stress of managing your work schedule. So overall, we see that this amount of stress that we are having in our life has gone up. So introducing some stress management techniques, for example, meditation, pranayam, yoga in your life, that is really going to boost your mental health. Going to a mental health practitioner if you're having some issues in your life to try and proactively deal with it, all these things are going to really help uh, take down your stress levels, and indirectly it affects your egg quality. Um, managing your sleep cycle is also really important when it comes to egg health, because if you have a good restful sleep in the night, all your hormones are going to try and come back into sync during that time. So when you wake up feeling refreshed, when you wake up feeling energetic, that is the best way to go about. So if you're somebody whose sleep is disturbed, try and find out what is the reason for that, and try and fix it, and you will see that that also helps your fertility and conception. Next, really important sort of thing to do is take your supplements. So, if you're somebody who's trying to conceive, do visit a fertility specialist or an obstetric and gynec person, and do take your prenatals and antioxidants, because that we have seen really boosts the egg health. It will also help into egg rupture, and it will also help in implantation of the embryo. So really important that you boost your egg health with these supplements like CoQ10, supplements like folic acid go a long way into helping you conceive. Again, we cannot stress enough on hydration and exercise. These things really boost the pelvic blood flow. It increases the blood supply going to your ovaries, going to your eggs, and it directly helps you to conceive faster and more effectively. And the last point of today's presentation is, of course, freezing of eggs. So, if you're somebody who wants to push back on your reproduction, if you're somebody who wants to focus on your marriage, who wants to focus on your life, on your career goals, if you're somebody who doesn't, maybe just doesn't want to get married right now and has no plans in the coming decade or so, and you can go for egg freezing. So, what is egg freezing? Essentially is we are growing the eggs into your ovary, Then we are giving injections to mature those eggs. And in the procedure of egg pickup, we are giving you anesthesia, putting in a needle in your ovaries and sucking those eggs out of you. Then we are grading those eggs and we are freezing. So it is a sort of a biological freezing of your eggs. So as you age, your egg quality goes down, your count goes down. But if you have somebody who has frozen your eggs, then by default your eggs are going to remain locked in that particular biological age. And then you can be stress free, you can go ahead with your plans and come back maybe 5 years, maybe whatever number of years you want, and then use those eggs which have been frozen, and that we have seen really can help you manage your fertility goals well. So this is one of the wonderful creations of modern science. So it's important to know these things, it's important to understand how they work. It's important to not come to a fertility specialist when it's too late, when all of your reserve is gone, when your egg quality has dipped. So proactively taking these decisions, proactively coming to a fertility specialist, chalking down your fertility goals is something that everybody must think of. The primary message that I want to give today is, as women age, their eggs are going to die over time. The quality of these eggs are also going to deteriorate over time. So it's really important that we focus on getting there early. We focus on nutrition, exercise, hydration, sleep, and everything, so that our hormones stay in sync, our blood flow to the eggs are good. We focus on not smoking, not alcohol, no recreational drugs, so that we are going to save these ovaries, we are going to save the egg quality. And if you're somebody who cannot work in these angles, then make sure that you are somebody who's approaching a fertility specialist for egg freezing, so that at least you have that option at the end of the day, and you do not go to a fertility specialist when it's too late, when they cannot help you with these things. So these are some of the tips to boost your egg quality. If there are any more questions about this topic, we'd love to have questions. Below given is the fertility helpline number, and you can call on this number for any more questions on egg health or any fertility related questions, or you can directly take an appointment. Our centers are in Kharadi and Wakad as well. So if there are any more questions on egg health or egg quality? So the question is, what are the signs of poor egg quality? So egg quality per se will not give you any sign. When your egg count decreases, when you go in poor ovarian reserve, then you may see that your periods are coming either very closely together, or if they can be interspersed as well, they can be very late as well. So if your egg is not growing in the right timeline, then there's a sneaking suspicion in your mind that maybe there is some issue regarding either my eggs, that either the count and quality has gone down, or maybe you have even the other spectrum, when you have PCOD as well, when there's a lot of eggs but no one egg is growing up. That is why your periods can be late as well. So the one of the primary symptoms I would say is that your periods being irregular, your periods being too close together, or your periods being too far spaced is one of the signs in which your body is trying to tell you that hey, something is wrong with your ovaries, something is wrong with your eggs, and that is something that you have to go get checked. Otherwise, body wise, you may not really feel any egg quality symptom as such. So that is about the science of poor egg quality. Okay. Does folic acid improve egg quality? Yes, folic acid will go a long way in improving your egg quality. Not only does it increase your egg quality, it has also been shown in a minor way to improve the overall rupture. And also, folic acid is something really important when it comes to after embryo implantation, for the proper growth of the baby. The neural network of the baby grows well if you have folic acid in your system. So folic acid is something really important to take before conception, around 3 to 4 months, or even before starting trying to conceive. So if you're somebody who's planning to conceive, then I would suggest you start folic acid as soon as possible, and not wait until conception, or not wait until you know that you are carrying a baby. You should start folic acid before starting your plans to conceive. What destroys egg quality? Okay, so interesting question. All the reasons that I have told that you should focus on if you don't focus on them, those are the list of things that actually go and destroy egg quality. So for example, junk food, outside eating, use of coloring agents, use of dyes, use of MSG will decrease your egg quality. Lack of proper nutrition, lack of proper sleep cycle, lack of proper exercise will destroy your egg quality. Stress, or on a prolonged stressful period, chronic stress is something that is going to directly hamper your egg quality. Smoking will hamper your egg quality, but there are other really important things. So these are lifestyle factors, but your eggs are primarily also can be destroyed if you are somebody who is taking cancer and chemotherapy. So you've got to be very important if you've not had kids, and you're go for any sort of methotrexate or any cancer therapy, then you have to protect your eggs. You have to discuss it with your doctor that, I am still going to go ahead with my reproductive plans later on. So what can we proactively do for this? So this is again a very important point to remember when it comes to egg quality. All sorts of addictions, alcohol, smoking, recreational drugs directly impact egg quality. So there are a lot of things. Also, something that is right now not in our hands, for example, environmental pollution has a great impact on your egg quality. So that is why we need to focus on antioxidant usage and everything. So all these things will impact your egg quality. Right. So that is it for today. Do give us a call on our fertility helpline number for any more queries. Thank you so much for logging in.